But I'd just like to say it is, just to repeat what the Premier said, it's good to see everyone out tonight. But there are many things happening in health, and two initiatives that I think are of great national importance. The public-private partnership at the hospital, and also the National Health Plan. And there is another initiative that I think is of great importance, which will generate much talk in the very near future, I think, is the discussion paper which I laid before the House before we broke for Christmas, which was that of the elimination of upfront payments. After much talk with my technical officers and, of course, the people in the street, this is something that I think has been on many of our minds for a long time. And the consultations have begun with the stakeholders, and I look forward to a positive resolution and us moving forward with the upfront payment elimination very quickly in the new year. With a short time frame, and I know that folks are anxious to ask questions, I may be like a bit of a pinball tonight and move around a bit, but I'll try to give you everything as summarized as best I can. With regard to the hospital and the public-private partnership, as many of you will know, it's the first public-private partnership in our history, and I'm happy to say that it is going very well. It's on budget, it's on time. We can expect no additional charges to the government. So I'm very pleased about the way it's going and the way it's heading, and that we know that we've received a price for it, and that's the price that we're going to pay. No more, no less. And if they do fall behind, the dime is on them, the contractor, not the government. And it's in their best interest to finish as soon as they possibly can. So, but they're doing well, and it's on time and on budget. The hospital itself, I think that many of us in this room will know that 5 or 6, 7 years ago, I don't think a day went by without a complaint of some kind being plastered in the front pages of the newspaper. I'm happy to say again that the hospital has made drastic improvements with regard to the way the hospital's run, the services that it provides, and the people, the expertise that we have on board. And of course the staff, 1,800 staff, certainly deserve a lot of credit for where the hospital has gone in the last 5 or 6 years. Customer satisfaction survey results have improved tremendously over the last few years, and now they're above 80% in some areas and over 90% satisfaction in others. The one area which they have not improved in, but that should improve by the end of this year, will be the food satisfaction. When food is supposed to be served hot, it will be served hot. And when it's supposed to be cold, it will be cold. So I'm told that at the end of this year, we should see some satisfaction improvements in large percentage numbers. The hospital continues to invest in capital improvements outside of the new wing, and that will continue with the purchase of new equipment, renovating of the existing hospital after we move into the new. So that is in the plans, it's in the works, and the budgets have been predicted, and we're hoping that with all going well, we will stick to those budgets. With regard to the Mid-Atlantic Wellness Institute, MWI Maui, we have a new Bermudian chief of psychiatry, which is very good news for us as Bermudians. The succession program that they have at Maui is doing really well. One of the success stories at Maui over the last few years has been the reduction of institutionalized population from over 300 to 100. We have about 30 group homes outside of MWI that is fitting in very nicely with the program. The Health Insurance Department, who are responsible for the cost administering of HIP and future care, we continue to review the Health Insurance Department with regard to their efficiency and effectiveness, and we're looking at doing some really good things in the Health Insurance Department this year, so keep an eye out on that. The Department of Health, Orange Valley, and also Opportunity Workshop. As you will know, that there's been a bit of press about the space needed, and some of our people that have some disability challenges. There's been a gap between Hope Academy and also Orange Valley, and we're looking at filling that gap. And whilst I will make no promises, it's high on my agenda to see that we can fulfill that. I met with about 120 people just before Christmas. It included physicians, parents, and some of the folks themselves with disabilities. So it's high on our agenda. With regard to the National Health Plan, the year 2010, $638 million is what it cost us as a country for our health, all our health care. And with the actuaries telling us that we're looking at an 8 to 10% increase per year. That's unsustainable, and we must, as a country, do something about it. The National Health Plan, as you know, was rolled out last year. We had 3 months of meetings, 44 meetings in all. We produced a consultation feedback paper, and then we produced the final National Health Plan. I'm happy to say that the task groups have been formed and they're hard at work. So we're looking for some really good things with regard to moving forward with our healthcare cost control heading into the future. There's much work to be done with regard to healthcare costs. We did host the Caribbean Conference on Health Financing Initiatives here last year, as well as we attended the Health Financing Conference in Cayman, and to try and get a better grip on health financing, not only in Bermuda but worldwide. And every other country that I've talked to, anyone, any other health minister, anyone in the health industry, everyone, you will be well aware that United States are struggling with health care costs. So that's a big issue for us worldwide. Primarily, our seniors, they're living longer. And our senior population in Bermuda will double in the next 13 years. So, you know, they're going to need some extra help from us. And I noticed Mr. John Payne, who is here tonight, he is well aware of those difficulties and challenges that we will have going forward. So, folks, as far as that goes, I would only like to leave you with 3 points. And I drew these from a ministerial statement that our Premier read last year. And the 3 points are this. We as a people must ensure that those who are most in need receive assistance. The people that are most in need receive assistance. We must do that as a people. 2, you will know that it's often spoken about doing more with less. And we, as a government, must learn how to do less with less. And we're certainly on that track. And the last note I'll leave you with is that governments cannot be everything to everyone. Thank you very much.